During the standard eye checkup, we aim to give the most comfortable and suitable contact lens for the patients. This video will show you some of the things we do, as well as the importance of coming back for lens aftercare, which many are not aware of.
You should always be careful when you open the blister pack. You should do this at the sink or under a place with sufficient light to prevent dropping the lens. Now I will be inserting the lens into your eye. Once the lens has settled down, you are ready to proceed to lens fit assessment.
Now, we are assessing the fit of the contact lens by using the several observations below. Primary gaze is to test the movements of the lens when looking straight ahead. By doing so, we'll ask the patient to look straight and blink normally. Up gaze is to test how much the lens drops down after blinking. So we'll ask the patient to look up and blink normally. Lag is to test how well the lens follows the eye when looking left and right. So we'll ask the patient to look left and then look right. Sag is to test how much the lens drops down. So we'll ask the patient to look up and don't blink. Centration is to check whether is the lens centered well on the eye. So we'll lift up the lower and upper eyelid of the patient and check whether are the lens covering the eye equally. Coverage is to check whether does the lens cover the eye completely. Comfort is to know how well the patient feels with the lens on their eye. So we'll ask the patient to grade the comfort of the lens, 0 being very uncomfortable and 4 being very comfortable. Push-up test is to test whether is the lens tight, loose or acceptable. So we'll use the lower eyelid to push the lens up and see how fast the lens drops down.
Removing the lens from the eye. It is important not to directly remove the lens from the cornea. This is to prevent any damages that may happen to your cornea accidentally. So firstly, you put the lenses at the palm of your hands, and you should have a lens stopper or the drainer in case you drop your lens into the sink. Cleaning should always be done at the sink. When you use solutions such as a multi-purpose solution, you put a few drops on the lens. Then you use a rubbing technique such as a up, down, left, right, or rub the lens in a circular motion for about 20 seconds to ensure that the lens is tight. You should flip the lens over and do the same thing for 20 seconds. If you are inserting the lens into your eye, you may want to rinse the lens with saline to reduce the stinging sensation upon the insertion of your lens. If you are storing the lenses, you can use a storage container like this, which normally comes with the solution. Rinse the storage container with multi-purpose solution. Before you store it, fill the container up to a line that you see in the container. After washing the lens, you put the lens inside and store it for a maximum of 1 week with multi-purpose solution. You will need to change the solution every time you wear your lenses, or you have to change it weekly if you are not wearing it. Upon opening of the bottle, remember to write down the date of the opening of the bottle and ensure that you throw away the solution 1 month after the opening of the bottle unless stated otherwise. This is to be done whether you have finished using the solution. It is important to change the container on a monthly basis to avoid the forming of microorganisms that can infect your eye. Other cleaners like these can also be used, but do be careful and remember to rinse the lenses with saline if you are storing or wearing it. These cleaners cannot be used for storing lenses.
Firstly, for corneal staining, the definition is the dotty appearance of the cornea when applied with fluorescein. The causes can be wearing lens for extended period of time, or lack of hygiene when handling lens. So for management-wise, we will normally advise patients to stop wearing lens for the time being, and use of lubricants or eye drops to reduce staining. Hence, it's very important to have good hygiene with contact lens. For acanthamoeba keratitis, the definition is that it's the infection of the cornea caused by infectious microbes found in tap water or sewage. The causes include allowing contact lens to come in contact with any tap water, for example, with activities such as bathing, swimming, washing of lenses in tap water. Management is to avoid allowing contact lens to come into contact with any tap water, or to administer topical antimicrobial agents. Blepharitis is the inflammation of the eyelids. It is caused by the crusting of eyelids and the accumulation of debris at the eyelids. For management-wise, it requires regular eyelid hygiene to clean and remove debris from eyelid, and it requires regular treatment, such as putting of antibiotics treatment and steroid cream. Cornea scarring is the permanent scratch on the cornea caused by an accident or trauma. It can be visible with the naked eye and will reduce eyesight of the patient. It is caused by poor hygiene and lack of protection for the eye when performing particular jobs such as construction. For management-wise, patient has to practice proper lens handling, wear goggles or protective eye gear when doing the particular duties, or cornea transplant if the scarring affects vision of the patient. Cornea ulcer is a whitish lump due to bacterial invasion to the cornea after a trauma or injury. It causes eye irritation with contact lens wear, injury of cornea when contact lens is rubbed against it. For management-wise, patients can use topical antibiotics or practice good hygiene, or even referral to ophthalmologists. Fungal keratitis is an infection of the cornea by an infectious fungal agent due to an injury to the cornea. It can worsen with the use of contact lens. So for management-wise, patient will have to discontinue wearing contact lens and use the prescribed topical antifungal drops. In severe case, the patient may require a cornea transplant, which may not restore vision. Giant papillary conjunctivitis, also known as GPC, is when the inner surface of the eyelid is irritated and inflamed. Every contact lens user is susceptible to this condition, whereby patients have poor hygiene, and it may also be due to allergy conditions. Management-wise, the patient has to practice good hygiene when handling contact lens, or they will have to use topical steroids. Herpes simplex keratitis is the viral infection of the eye, which is caused by the transfer of virus from a cold sore or blister to the eye. Management to patients is that they have to practice good hygiene or use antiviral drugs. In worst cases, they have to be referred to the ophthalmologist. Superficial punctate keratitis, also known as SPK, is the inflammation of cornea with scattered fine punctate corneal epithelial cells or damage. It is caused by the extended wear of contact lens. Management-wise, patients have to use topical corticosteroids, or in worst case scenario, they have to be referred to the ophthalmologist. Neovascularization is the growth of prominent blood vessels onto the cornea. It is caused by a lack of oxygen flow to the cornea due to extended wear of contact lens. Advice to patients would be to discontinue wearing of contact lens, or they could change their contact lens to one of higher oxygen permeability or getting looser lens fit.